Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, over the past year, I've noticed my hearing isn't what it used to be. My right ear especially doesn't pick up sounds like before, and there's this constant ringing in my other ear. My father had hearing problems too, so maybe it runs in the family. I use ear protection at work where we deal with a lot of noise from the machines, but it hasn't really helped much. I'm worried this might get worse.
I understand your concerns, especially with your family history. It's good that you're using ear protection. Can you tell me more about your work environment and any measures you've taken so far regarding your hearing?
Well, I work in our family business, manufacturing aluminum awnings. It's a noisy environment with lots of metal cutting and assembly operations. I've been using standard earplugs, and we do have some noise protocols, but maybe they're not enough. Outside work, I avoid loud places, trying to give my ears some rest.
It sounds like you're taking reasonable steps to protect your hearing. Let's keep monitoring that situation. Now, about your sleep. How are your sleep apnea symptoms, and how have you been managing?
It's been tough. I've used a CPAP machine for a while, but sometimes I wake up gasping for air, and it feels like my throat is blocked. I suspect my acid reflux is playing a role here, as I've had some bad flare-ups recently. It's affecting my sleep quality, and I feel tired during the day.
That's concerning. Waking up gasping for air can indeed be aggravated by acid reflux. You mentioned you're currently taking omeprazole. Has there been any improvement with your reflux symptoms?
Somewhat, but not completely. I still experience a chalky taste and occasional stomach pains. The medication helps, but I think the hiatal hernia complicates things. An endoscopy a while back confirmed its presence. I've been trying to manage my diet, avoiding foods that trigger my reflux, like spicy dishes and alcohol.
Diet management is crucial for acid reflux, especially with a hiatal hernia. We might need to reassess your medication and consider whether a higher dose or a different medication could help better control your symptoms. Let's also think about another endoscopy to check on the hernia. Have you noticed any changes with your breathing, unrelated to the apnea or reflux?
Yes, actually. There are moments when I feel short of breath, and it's not when I'm exerting myself or anything. It just comes out of nowhere. It's not frequent, but it's unsettling when it happens.
We should definitely look into that further. An echocardiogram might help us rule out any cardiac issues like pulmonary hypertension, which can sometimes present with symptoms like yours. We'll plan that along with the other tests. Now, have you noticed any other changes in your health or anything else that's concerning you?
No. Those are the main issues. But I'm really concerned about my health benefits changing soon. I've heard some talks about adjustments to veteran benefits, and I'm worried about how it might affect my access to medications and treatments.
I understand that changes in health coverage can be concerning. Let's ensure we stay on top of that, and I'll help you navigate any changes to ensure you continue receiving the care you need. Here's what we're going to do moving forward. We'll schedule a follow-up audiology test since we've noted mild sensorineural hearing loss in your right ear and your left is currently stable. We'll also arrange a sleep study to adjust your CPAP settings and explore further evaluations for your sleep apnea.
That sounds good, doctor. I appreciate your help in managing all these things.
Absolutely, I'm here to help. Additionally, we'll proceed with the echocardiogram and a repeat endoscopy. I'll coordinate with our scheduling team to fit these appointments into your flexible work hours. It's important that we take a comprehensive approach to manage your conditions effectively. I'll also keep an eye on your medication refills and any changes in your insurance benefits. Any questions before we wrap up?
No, that covers everything. Thank you for explaining the steps and for looking into the insurance aspect as well.
You're welcome. It's important to address all your concerns. We'll see each other soon for the follow-ups, and please don't hesitate to reach out if anything changes or if you have any more concerns.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, doctor. I wanted to discuss a few concerns I've been having lately. I've been experiencing frequent urination, especially at night. It's getting to the point where it really affects my sleep because I'm up 3 or 4 times. I'm also feeling some discomfort that makes me think it could be my prostate.
Good morning. I see. That sounds quite disruptive to your sleep. We will definitely look into the prostate issue more closely today. Is there anything else that's been bothering you?
Yes, there's also this persistent pain and needle-like sensations in my feet. I've been using a cream my podiatrist prescribed, and it helps a bit, but the pain is still quite bothersome, especially when it flares up. My friend had similar symptoms, and it turned out to be neuropathy related to his diabetes.
I'm sorry to hear that. We'll review the effectiveness of the topical treatment and discuss additional options like gabapentin if it continues to be a problem. How about your general mobility and daily activities?
Well, I had a fall earlier this week. I think it might have been due to my blood sugar dropping too low, but I didn't check it at the time. Luckily, I wasn't seriously injured. It's just made me a bit more cautious around the house.
I'm glad to hear you weren't hurt. Managing your diabetes is crucial, especially to prevent incidents like that. How have your blood sugar levels been recently?
They've been higher than usual, around 250 milligrams per deciliter in the mornings. I'm still taking metformin, but it doesn't seem to be enough lately. And I also ran out of my cholesterol medication, simvastatin, which I need to start again.
It's important we stabilize those levels. High blood sugar can contribute to neuropathy and other complications. We'll arrange a blood test today to check your current diabetes control and your cholesterol levels. Have you had any difficulties obtaining your medications?
Yes, actually. I've had some problems getting my medications by mail. Sometimes there are delays, which means I run out before the new supply arrives.
That's frustrating. We'll need to find a more reliable solution for you. It's essential to keep your medication regimen consistent, especially for diabetes and cholesterol management. Let's also discuss your lifestyle habits. What's your current diet and exercise routine like?
I've been trying to eat healthier and manage my portions, which has been somewhat successful. I don't get much exercise, though, mostly some walking when I do grocery shopping.
Maintaining an active lifestyle is beneficial, especially for managing weight and improving blood sugar control. Even light daily activity can make a difference. Now, how about your support at home? How is your family involved in your care?
My family has been very supportive. They help out when I need it and are involved in my care, especially since my fall. We manage the household tasks together, like cooking and shopping.
That's wonderful to hear. A supportive environment can significantly help in managing your health. Now, based on what we've discussed, I recommend a few next steps. Firstly, we'll recheck your prostate health given your symptoms and consider starting tamsulosin to help with urination without affecting your blood pressure. We'll also follow up with your podiatrist about the neuropathy and potentially add gabapentin if the cream isn't sufficient.
That sounds good. I just want to make sure everything is managed properly and that these issues don't get worse.
Absolutely, that's our goal. We'll also restart your statin therapy for cholesterol, and I'll arrange for your blood tests today to check your diabetes control and prostate health indicators. It's important that we monitor your condition closely and adjust your treatment as necessary.
Thank you, doctor. I appreciate your help. I've been quite worried about all these health issues, especially with what happened to my friend.
I understand your concerns, and we're here to support you every step of the way. We'll meet again in about 3 to 4 months for a follow-up, unless you have concerns or worsening symptoms before then, in which case you should come in sooner. It's important to keep an open line of communication.
I will, and thank you again for all the information and planning today.
You're welcome. Take care and see the front desk on your way out to schedule your follow-up appointments and blood tests. We'll tackle these issues together.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
I've reviewed the imaging from your patient's CT scan, and there is evidence of a small, well-defined mass in the left lung. It measures about 1.5 centimeters in diameter. The edges are smooth, which sometimes suggests a benign process, but we cannot rule out malignancy based solely on imaging.
Thank you for the detailed update. Given those findings, what would you suggest as the next steps? Should we consider further imaging or go straight to biopsy?
Considering the patient's smoking history and the characteristics of the mass, I recommend a PET scan to assess metabolic activity. This can help us determine the urgency of a biopsy. If the PET scan shows high metabolic activity, we'll need to proceed with a guided biopsy to obtain a definitive diagnosis.
That makes sense. Assuming the PET scan suggests a malignancy, How soon could we arrange for a biopsy, and what would be the implications for the patient's treatment plan?
If the PET scan results are concerning, we can schedule a biopsy within the week. Based on the biopsy results, we can discuss whether surgical intervention or other treatments like chemotherapy are advisable. I'll make sure to expedite the scheduling and keep you updated on all developments.
Now look at question 26.
Welcome to today's session on blood transfusion procedures, a critical component of patient care in our hospital. First, we must ensure proper blood type matching and cross-matching to avoid adverse reactions, which are rare but potentially severe. Every transfusion must begin with informed consent, unless it's an emergency situation where consent is presumed. Throughout the transfusion, it's crucial to monitor the patient's vital signs closely. This includes regular checks of blood pressure, pulse, and respiratory rate to catch any signs of transfusion reactions early. The transfusion should be administered according to the prescribed rate, and post-transfusion, patients must be monitored for signs of delayed reactions. It's also vital to document every step in the patient's medical record, including the donor blood type, volume of blood transfused, and any reactions observed during and after the procedure. This documentation is essential for ongoing patient safety and care.
Now look at question 27.
As you recover from your surgery, it's crucial to follow these post-operative care instructions to ensure a smooth recovery. First, managing your pain effectively is key. We've prescribed a combination of medications that should control the pain without causing undue side effects.
What signs of complications should I watch out for at the surgery site?
You should watch for signs of infection, such as redness, swelling, or drainage from the incision site. Also, a fever could indicate an infection. It's important to keep the surgical area clean and dry, and you should report any of these signs to us immediately.
In terms of activity, what limitations will I have?
You should avoid lifting heavy objects or engaging in strenuous activity for at least 6 weeks. We'll start you on a light activity regimen and gradually increase it based on your healing progress. Also, remember to maintain a nutritious diet to support your recovery and keep hydrated.
Now look at question 28.
The training focuses on geriatric assessments, which are designed to evaluate the comprehensive needs of our elderly patients. These assessments cover multiple aspects: physical health, mental health, and functional ability. In our assessment, we use several standardized tools. The Mini Mental State Examination, MMSE, helps us evaluate cognitive function, which is crucial for planning further care and support. The Activities of Daily Living, ADL, Scale and the instrumental activities of daily living, Yale scale, help us understand the patient's ability to perform everyday tasks and live independently. Based on the results of these assessments, we can tailor interventions to improve quality of life. This might include medication adjustments, physical therapy, or changes in living arrangements. It's essential that we also communicate effectively with the patient's family to ensure they understand the care plan and how they can support the patient's health and well-being.
Now look at question 29.
Based on the recent tests and the symptoms you've described, it's clear that we're dealing with asthma. We'll start treatment with a combination of inhaled bronchodilators and corticosteroids. These medications should help control the symptoms and prevent severe episodes.
How often should these medications be administered, and are there any side effects we should be aware of?
The bronchodilator should be used as needed when symptoms appear, while the corticosteroid is used daily to control inflammation in the lungs. Common side effects might include a bit of hoarseness or a yeast infection in the mouth, but using a spacer with the inhaler and rinsing the mouth after each use can help minimize these issues.
What about long-term management? How can we help our child avoid triggers?
It's important to keep your home free of common asthma triggers, such as dust, pet dander, and tobacco smoke. Regular follow-ups will help us adjust the treatment as your child grows and his or her condition changes. We'll schedule the next appointment in a few weeks, but if symptoms worsen or don't improve, please contact us right away.
Now look at question 30.
Now we'll discuss the critical importance of informed consent in medical practice. Informed consent is not merely a formality, but a fundamental patient right that underscores our ethical commitment to respect patient autonomy. The process begins by thoroughly explaining the proposed procedure or treatment, including potential risks, benefits, and alternatives. It's crucial that the patient understands all aspects of the procedure, and we must ensure they feel free to ask questions and express concerns. Once we've provided all necessary information, we document the patient's decision-making process. This includes noting their questions, their understanding of the information, and their voluntary agreement to proceed. Remember, informed consent is a continuous process, not a one-time formality. It should be revisited anytime new information arises that might affect the patient's decision.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Hello and welcome to our comprehensive seminar on understanding and addressing microaggressions in healthcare settings. I'm Dr. Elaine Thompson, and today we will delve into the subtle yet significant impacts these seemingly minor interactions can have on patient care and workplace dynamics. Our goal is to foster a more inclusive environment that promotes optimal health outcomes and professional respect. Microaggressions are brief and commonplace verbal, behavioral, or environmental indignities. Whether intentional or unintentional, they communicate hostile, derogatory, or negative prejudicial slights and insults toward any group, particularly culturally marginalized groups. In healthcare, this could relate to a patient's or colleague's race, ethnicity, gender, sexuality, or disability status. To frame our discussion, let's consider a case study involving a hypothetical patient named Maria, a 54-year-old Latina woman managing chronic type 2 diabetes. Maria regularly visits her healthcare facility for management of her condition. During one of her appointments, a new nurse remarked, "You speak English so well," upon learning Maria was born outside the U.S. While not intended as a slight, the nurse's comment reflects a common stereotype about non-native citizens and their language abilities. Such comments can create a feeling of otherness and alienation for patients. This interaction, though small, illustrates a microaggression that can undermine the trust between healthcare providers and patients. According to Su et al., 2007, microaggressions can cause psychological distress and may discourage patients from seeking necessary medical care. This is particularly critical in healthcare, where effective communication and trust are paramount to achieving the best clinical outcomes. Identifying microaggressions involves a process of education and awareness. Healthcare providers must be trained to recognize their biases and the biases embedded in the healthcare system. This training should cover effective communication strategies, cultural competence, and the impact of societal stereotypes on patient care. Implementing reflective practice is another strategy. Healthcare teams can benefit from structured reflection sessions, where they discuss patient interactions, review feedback, and evaluate their communication for potential biases or microaggressions. Reflective practice not only aids in personal growth, but also enhances team dynamics and patient care quality. Furthermore, establishing robust reporting mechanisms is essential. These should allow both patients and staff to report experiences of microaggressions without fear of reprisal. Data from these reports can be analyzed to identify patterns and develop targeted interventions to cultivate a more inclusive environment. Leadership commitment is crucial in addressing microaggressions. Leaders in healthcare settings must advocate for and enforce a zero-tolerance policy towards any form of discrimination. They should lead by example, promoting a culture of respect and inclusion. Policies on recruitment, retention, and promotion also need scrutiny to eliminate biases that may perpetuate exclusion or microaggressions. Now, let's consider the broader implications of effectively addressing microaggressions in healthcare. By proactively creating an inclusive environment, healthcare providers can significantly improve patient satisfaction and treatment adherence. This is likely to lead to better patient outcomes. Additionally, a respectful and inclusive workplace enhances job satisfaction, reduces professional burnout, and decreases staff turnover. For a practical approach, let's reflect on how to initiate change within our individual scope of practice. It starts with self-awareness, recognizing our own potential biases and their origins. Engage in continuous education about cultural competency and interpersonal communication. Listen actively to the experiences and concerns of colleagues and patients from diverse backgrounds. Be an advocate for change, supporting initiatives that promote inclusivity and respect in your professional community. While the challenges of addressing microaggressions in healthcare are substantial, the benefits of such efforts are even more significant. They extend beyond individual patient encounters, influencing the broader organizational culture and contributing to the overall health of the community. Thank you for participating in today's seminar. I encourage you to reflect on this discussion and consider how you can contribute to creating a more inclusive and respectful healthcare environment.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Hello everyone. Today I'm delighted to be joined by Dr. Blackstock, who is a consultant in intensive care and anesthesia. Today we are going to be talking about subarachnoid hemorrhage, so welcome Dr. Blackstock.
Thank you, Alex. It's a pleasure to be here.
Let's get started. Why are we talking about subarachnoid hemorrhage, and why is it so important?
Subarachnoid hemorrhage is a critical condition that presents in various forms and can impact individuals suddenly without warning, often in the prime of their lives. It can lead to significant morbidity and mortality and requires immediate and effective management. It's a condition that spans multiple specialties, often involving critical care for effective management and coordination.
That's a great introduction, Dr. Blackstock. As a medical trainee, I often encounter patients presenting with a sudden, severe headache, often described as the worst headache of their life, which peaks within seconds to minutes. This hallmark of subarachnoid hemorrhage signals an emergency requiring prompt attention. Could you explain how common this condition is and who is most at risk?
Certainly. Subarachnoid hemorrhage occurs with a prevalence of about 10 per 100,000 annually. In Scotland, this translates to around 500 cases each year. While not extremely common, it's frequent enough that it affects about 2 individuals per week who present to hospitals. There's a slight female preponderance, and it mostly affects individuals in their 40s and 50s, though it can occur at any age.
That's insightful. It's critical to differentiate between traumatic and spontaneous subarachnoid hemorrhages, the latter typically resulting from a ruptured aneurysm. What are the pathophysiological mechanisms behind this spontaneous type?
The majority of spontaneous cases result from the rupture of cerebral aneurysms, particularly berry aneurysms. These are often located at arterial junctions within the circle of Willis, where arterial walls experience high shear stress. Risk factors include genetic conditions like polycystic kidney disease or connective tissue disorders, which can predispose individuals to aneurysm formation. The sudden increase in intracranial pressure from the hemorrhage leads to the severe headache that patients report.
Once a patient with suspected subarachnoid hemorrhage arrives at the hospital, Initial assessment and rapid imaging are critical. Could you walk us through the diagnostic and initial management steps?
The initial approach involves a non-contrast CT scan, which can quickly identify bleeding and is highly sensitive within the first few hours after symptom onset. If subarachnoid hemorrhage is confirmed, we proceed with a CT angiogram to identify any aneurysms. Managing these patients involves stabilizing their condition, controlling blood pressure, and preventing further bleeding by securing the aneurysm through surgical or endovascular means, typically with coiling or clipping.
Management sounds complex and highly multidisciplinary. Could you discuss the role of different specialties in this context?
Indeed, the management of subarachnoid hemorrhage requires a coordinated approach involving emergency physicians, neurosurgeons, interventional radiologists, and critical care specialists. Neurosurgeons manage surgical intervention, while interventional radiologists perform procedures like coiling. Critical care specialists are crucial for managing the patient's vital functions and complications.
Dr. Blackstock, considering the seriousness and complexity of subarachnoid hemorrhage, could you share a specific case to illustrate these points?
Certainly. Let's consider a case of a 45-year-old female patient who presented with a sudden onset of severe headache and photophobia. She was initially alert but deteriorated rapidly, showing signs of neurological decline. A CT scan performed within 2 hours of arrival confirmed a subarachnoid hemorrhage. Immediate CT angiography revealed a 7 mm anterior communicating artery aneurysm. The patient was stabilized in the ICU, where her blood pressure was meticulously managed, and she underwent successful endovascular coiling within 12 hours of presentation. Her recovery involved careful monitoring for complications like vasospasm and hydrocephalus, requiring multidisciplinary teamwork for optimal outcomes.
That case really highlights the importance of rapid and coordinated care. As we wrap up today's discussion, what are the key takeaways for our listeners regarding the management of subarachnoid hemorrhage?
The key points are to recognize the urgency of subarachnoid hemorrhage, initiate prompt diagnostic imaging, and manage it with a multidisciplinary approach to prevent complications and improve outcomes. Early intervention, particularly securing the aneurysm and managing cerebral perfusion, significantly affects the prognosis.
Thank you, Dr. Blackstock, for such a thorough discussion. It's been extremely informative, and I'm sure our listeners have gained a deeper understanding of how to approach and manage subarachnoid hemorrhage effectively.
Thank you, Alex. It's been a pleasure discussing this vital topic with you and the listeners. Remember, timely action and teamwork are crucial in managing such critical conditions.